Today's topic is lung abscess. From the name itself, we can identify that abscess means pus collection. So, lung abscess means pus collection in the lung. In this picture, you can see that a cavity is formed. So, in this cavity, the pus will be collected. So, that is known as the lung abscess. The definition of lung abscess is a pus containing lesion of lung parenchyma that give rise to a cavity. Okay, so that is lung abscess. Here there will be cavity in that pus collection. So that is known as the lung abscess. We can see what is the etiology of lung abscess. Most of the time, pneumonia is a causative factor for lung abscess. It may be necrotizing pneumonia or aspirational pneumonia. And another etiology is bronchial obstruction. Then systemic sepsis. Sepsis means it's a inflammation or infection. The systemically there will be infection and that leads to finally systemic sepsis leads to a shock, stage of shock, septic shock. Then pulmonary trauma. Then direct extension of pneumonia to a lung abscess. So, lung abscess, the etiology mainly the aspiration, especially the risk factors of aspiration is alcoholism, seizure disorders, neuromuscular disorders, drug overdose, general anesthesia, stroke. All this category, there may be increased chance for the aspirational pneumonia. The pneumonia is a main causative factor for lung abscess. So that's why there is risk factors like alcoholism, seizure, and neuromuscular disorders, drug overdose, general anesthesia, stroke. Okay. Then there will be another etiology like inhaled foreign body. So inhaled foreign body that leads to the bronchial obstruction. Then the systemic sepsis, that is septicemia. Presence and persistence of Staphylococcus aureus or streptococci and then leads to toxemia. The streptococci, the organism that may release the toxins into our body and that leads to toxemia and later leads to shock. Then pulmonary infarction. The pulmonary infarction means decrease the blood supply to the pulmonary area. So that also a reason for a lung abscess. Okay, so these all are the causes of lung abscess. Pathophysiology of lung abscess. Due to etiological factors, the defense mechanism of lung will be lost. Due to that, there will be inflammatory reaction. This inflammatory reactions that leads to secretion and mucosal edema. So here there will be adequate ventilation will not be happen due to this inflammatory response. That's why there will be occlusion of bronchi or alveoli occurs. So here, due to this occlusion, there will be decreased alveolar oxygen tension and alveolar exudates will be consolidate and it will be difficult to expectorate. So here, the ventilation perfusion mismatch occurs and lung abscess finally form. In simple way, we can say that due to etiology, there will be inflammatory response. This inflammatory response that leads to vascular obstruction or the vascular occlusion. So that leads to tissue necrosis and liquefaction, ultimately leads to lung abscess. The clinical features of lung abscess, it includes the early signs are fever and chills due to inflammatory response. The person may show the fever and chills, and the person will have night sweats, persistent cough. Then later it leads to pain with deep breathing, then coughing, blood, that is hemoptysis, then fatigue. And chest pain is very important here. Chest pain will be present with deep breathing. Also, there may be chance for clubbing of fingers. Then weight loss, malaise also will be present. So, these are the clinical features. So, here early signs and late signs also present. In the early signs, here fever, chills, night sweats, persistent cough, and later it leads to pain in deep breathing, pain while deep breathing, then coughing, blood, that is hemoptysis, then the fatigue, weight loss, malaise, then increased WBC count, leukocytosis. All these features you can see in lung abscess. The diagnosis include history, physical examination, history of pneumonia, history of foreign body aspiration, and history of trauma. All this history you have to collect. Then physical examination, the fever, chills, hemoptysis, all these features you can observe. Then CT scan and MRI, chest X-ray, that will helps to confirm the disease. This is the X-ray findings of lung abscess. Here in this X-ray you can see that a cavity is formed, right? So this cavity, right, round shaped cavity, that is the lung abscess. Then in a CT scan, the arrow mark, the red arrow mark shows the lung abscess, and it's irregular in shape, but mostly it will be round in shape. It will be like a cavity formation. Okay, so the lung abscess CT scan can be in the CT scan also you can observe the lung abscess. The main management of lung abscess, it includes the person need to be admitted, and the antibiotic, especially the penicillin, gentamicin, clindamycin, all these antibiotics will be useful for the patient. And postural drainage, the postural drainage that will facilitate discharge of pus or necrotic material. Then chest physiotherapy, that includes coughing and deep breathing exercise to facilitate expectoration. Okay, then surgical treatment, that is rarely needed. Then frequent mouth care, then we have to observe the oral mucosal membrane in order to identify the candida. Then good nutrition, that is high protein, high calorie diet, that also you have to give to the patient. So main medical management, that is antibiotic therapy. Then the surgical management of lung abscess, actually surgical management is very rare, but a pulmonary resection or lobectomy is performed if massive hemoptysis occur if there is no response to medical treatment. So when there is no response to a medical treatment and the patient have hemoptysis, we are doing the surgical management, especially the lobectomy or pulmonary resection we are doing. The complications of lung abscess, it includes aspiration pneumonia, empyema, pneumatocoel, bronchopleural fistula, pleurisy, atelectasis, shock and respiratory failure. So as a conclusion, we can say that lung abscess is a collection of debris or pus that forms in the lung. As a cavity, the lung pus will be collected in the lung. The main risk factors or the etiology for lung abscess, it includes the pneumonia. Especially the risk are alcohol abusers, seizure disorders, then dental disorders, all those things. Then it also associated with obstruction and aspiration and immunocompromised patients. And the prevalence or the incidence that is common in males than females. The main symptoms is the fever, cough, then hemoptysis, weight loss, etc. Then it is caused by infection due to bacteria, virus or fungus, and it can be diagnosed by the blood test, chest x-ray, CT scan, MRI, all those things. Then 90% of cases will be resolved with medical treatment, that is IV antibiotics, at least for 2 weeks. Then the complications mainly the pneumonia, respiratory failure, lung gangrene or sepsis and shock also can be occur. Then abscess, brain abscess also common. And if the medical condition or medical treatment is not effective, we can do the surgical management like lobectomy or pneumonectomy. So these all are the lung abscess. I hope you understood regarding the topic. Thank you.